This video demonstrates a cervical epidural steroid injection using a translaminar approach at the C7-T1 interspace. With the patient prone on the fluoroscopy table and his or her face placed into a cervical prone cutout cushion, aseptically prepare the skin and drape the patient in a sterile fashion. Identify the C7-T1 interspace under fluoroscopic guidance with the C-arm in the AP projection. The first rib is an excellent bony landmark to quickly identify the C7-T1 interspace. To anesthetize the skin, use a 27-gauge quarter-inch needle to inject 1 to 2 milliliters of 1% preservative-free lidocaine without epinephrine so that a skin wheel is raised over the target interspace on the side of the patient's pane. Under fluoroscopic control, insert and advance a 22-gauge 3.5-inch spinal needle in a vertical fashion until contact is made with the upper edge of the T1 lamina, 1 to 2 millimeters lateral to the midline. Anesthetize the lamina with 1 to 2 milliliters of 1% preservative-free lidocaine without epinephrine. Anesthetize the soft tissues with 2 milliliters of 1% preservative-free lidocaine without epinephrine as the spinal needle is withdrawn. Insert an 18-gauge 3.5-inch 2E epidural needle and advance it vertically within the anesthetized soft tissue tract until contact is made with the T1 lamina under fluoroscopy. Walk off the lamina with the 2E needle onto the ligamentum flavum. Remove the stylet from the 2E needle and attach a 10 milliliter syringe filled halfway with air and sterile saline. Advance the 2E needle into the epidural space using the loss of resistance technique. When performing the loss of resistance technique, rest one hand on the patient to secure the 2E needle and use the other hand to advance the 2E needle slowly and gently, applying pressure to the syringe plunger with the thumb. When the tip of the needle passes through the tough ligamentum flavum into the epidural space, a loss of resistance can be felt, and the saline passes freely into the space. When loss of resistance has been achieved, aspirate to check for blood or spinal fluid. If neither blood nor spinal fluid is evident, inject 1.5 milliliters of non-ionic contrast dye. Confirm epidural placement by producing an epidurogram with the non-ionic contrast agent. Slowly inject 2 milliliters of 1% preservative-free lidocaine without epinephrine and 2 milliliters of 6 milligram per milliliter celestone soluspan slowly into the epidural space.